happened on a local football field and in a professional sports setting in front of thousands of people. Seemingly healthy young athletes dropping to the ground, suffering from a sudden cardiac arrest. Now, joining us to help us understand how this can happen is Dr. Malini Nadador, cardiologist with Kaiser Permanente. Thank you, doctor, for joining us bright and early talking about this subject.
Thank you for having me. Such an important subject. I'm happy we're starting the conversation early in the morning.
Absolutely. So how is it even possible for, like we said, a seemingly healthy young individual to suddenly go into cardiac arrest?
So there are some underlying conditions, but with cardiac arrest, the most important thing is early action. A small fact is that over 350,000 Americans undergo cardiac arrest annually. Only 10% survive. And why is that? It's because of people like you with information. Swift early action. What does that include? Calling for help, checking to see if there's a pulse, why they've collapsed, if they're not breathing, and then starting compressions, starting CPR, hands-only CPR. That's the key there.
And doctor, do they often misdiagnose a cardiac arrest for a heart attack? And if so, what is the difference between the two?
So that's a really good question. A heart attack can cause cardiac arrest. Cardiac arrest can happen because of multitude of reasons, including anything that can stop the heart from beating. So the point is chest compressions to reestablish flow of blood into the body and then figure out why it's happening. And that's what's important to get an AED if it's available and to call for medical professionals.
Are there any heart defects that can go undetected in children and young adults? I mean, that's why we have to get those screenings in for them, right, when they are young, those physicals.
There are a number, and screening is important. In these screening tests, you sometimes find irregular heart rhythms, murmurs, or even high blood pressure. But the important part is that if something is discovered during a screening, don't panic. Talk to your medical professional. Figure out the next steps, whether additional testing needs to be completed or if treatment needs to be started.
Okay, and then you touched on it briefly, but survival from a cardiac arrest depends, again, how quick the medical response is. Is there a certain time frame in which a person's life can be saved?
The faster, the better. Seconds to minutes. If you jump into action by recognizing and starting compressions, those first few minutes can be the difference between life and death.
And what are some telltale signs of a cardiac emergency that we can, if we see it happening, okay, this is what we need to do?
Sure. Classically, we see someone just pass out and faint, but chest pain, dizziness, looking queasy, nausea and vomiting, shortness of breath, all of these things are important. If you see someone in this condition, check their pulse, check for their breathing, look for their mental state. And then if you feel anything is compromised, start CPR and make that call. There's not a lot of harm to starting action quickly.
Right, get that response in as soon as you can, dial 911. And lastly, doctor, is there any words of encouragement you can send to a parent who's watching right now and maybe their kid was just recently diagnosed with some kind of heart defect or something?
Sure, I want to be reassuring here. We have so many resources on our hands. Talk to a medical professional. Don't get on the internet and just Google and decide that this is the course of action. We are here to help you work through this and to see if the condition your child has been diagnosed with is in fact something very harmful. And there are so many treatments to help your kids.
Perfect. Doctor, thank you so much for joining us this morning. Again, call the professionals. Don't just look up WebMD and freak yourself out. Thank you so much. We appreciate your time. 6:18.